on the pectoral girdle. The protraction is moving the part forward in this without changing the angle of the joint. In temporomandibular joint, in this joint, there is a thick articular disc, and here is the head of the mandible, and this is the temporal bone having fossa for this joint. So above the articular disc, the gliding movements are taking place. Gliding movements are taking place above the articular disc, but below the articular disc there is the hinge movements as well as limited gliding movements. So in temporomandibular joint, we can see the gliding movements, that is protraction and retraction, in the same horizontal plane without changing the angle, or angle is changed very little. This movement, that is protraction, retraction. Protraction, that is sticking of jaw, and tucking is retraction. In case of shoulder, this is protraction and this is retraction. This is protraction, this is retraction. Protraction, retraction. So in case of jaw, the protraction and retraction, the gliding of the mandible in the upper part of the articular disc, which is a thick disc, and it is divided into compartments. The joint cavity is divided into two compartments. Upper compartment permitting the gliding movements, and lower compartment is permitting the hinge movements as well as little gliding movements. Protraction and retraction. Besides protraction and retraction in the temporomandibular joint, or I can say the movements of the mandible, there are some chewing movements like this. In chewing movements, one part is depressed, like in one part there is hinge movement, and other opposite temporomandibular joint is permitting the rotational movement, and other is permitting the hinge movement. So in chewing, there is rotation on the one temporomandibular joint and the hinge movement in the opposite temporomandibular joint. The other set of the spatial movement is elevation and depression. Elevation, lifting some part is elevation, and bringing back to its original position is the depression. But in case of mandible, when we open our mouth, this is the depression of the mandible, and bringing back the depressed mandible is the elevation. So elevation and depression. In shrugging of shoulders, here is elevation and this is the depression. Elevation and depression. Elevation and depression. So elevation, lifting the part, and depression, bringing back the part on its original position is depression. The other set of the spatial movement is inversion and E-version. In case of foot, it is taking place on the subtalar joints. Foot is having plantar surface facing downwards and the dorsal surface facing upwards. When the medial border is off the ground and lateral border is on the ground and the plantar surface is facing medially, this is known as inversion. When the lateral surface is on the ground and the medial surface is or plantar surface is medial surface is off the ground and lateral surface or lateral border, I will better call the border. When the lateral border of foot is on the ground and medial border is off the ground and plantar surface is facing medially, this is known as inversion. This movement is taking place on subtalar joints. When we examine our plantar surface for any splint or prong, this movement is known as inversion. But when we face the or move the plantar surface towards the lateral and the medial border is on the ground and lateral border is off the ground, this is known as eversion. So inversion and eversion are taking place on the subtalar joint. Remember always, supination and pronation are not taking place on the ankle joint and subtalar joints. And there is no official term and official movement like pronation and supination in lower limb. So pronation and supination is always occurring on the radio-ulnar joints, not other joints of the body. So, I will briefly review this lecture again. There are 6 basic movements and some special movements. The basic movements are flexion, extension, adduction, abduction, rotation and circumduction, which is combination of flexion, extension, adduction and abduction, which is taking place on the multi-axial or polyaxial joints only. Special movements are elevation, depression, supination, pronation, eversion, inversion, protrusion, retrusion. One more special movement which makes human the master mechanic of the animal world. Human being is master mechanic of animal world because it is having big brain, the highest seat of consciousness, the cerebral cortex is large. The ratio of brain body is highest in human beings. But besides this big brain, it is also having the prehensile and skilled movement upper limb, and it is also having the erect posture, which became possible by rotation of lower limb and upper limb and by the development of anti-gravity muscles. Besides these all modifications, it is having the thumb. Thumb is having some different movements. These movements of the thumb, bringing the pad of thumb closer to the pulp spaces of fingers is known as apposition, and bringing back is reposition. So one important specific movement is apposition, and bringing back the thumb its original place is reposition. The value of forefinger is equal to value of the thumb during power grip, hook grip, or pressure grip. When we grip, when we write, when we operate our smartphone, when we operate our car or some other machine, the value of thumb is equal to value of forefinger. So always remember, thumb is having the movement of opposition and movement of reposition. So this was the lecture on the movements of the body. In my next lecture, I will talk about the general anatomy of the muscles, which are of 3 types.